Good morning, everyone. Welcome. Welcome to the 5th Annual Conference on Big Data and Biomedicine. The theme of this year's conference, as Carlos mentioned, is Transforming Lives Through Precision Health. And it's so wonderful and remarkable to see so many brilliant minds in this room and engaged elsewhere in this important endeavor. So I'd like to get us started this morning with 3 patient stories that really help to describe why I think all of us collectively are so excited about what we can achieve with precision health. The first story involves this family. Purnima in the slide here, as well as her husband Jishnu, and their 2 children, 3-year-old Arcadius and 1-year-old Sitha. Now, this story is happy at this point, but it didn't have a happy beginning. Because in 2012, Purnima gave birth to a 22-month-old child that didn't survive. She then sought the assistance of maternal fetal health experts here at Stanford and Lucile Packard Children's Hospital. She was carefully monitored. She was given medications and other treatments known to reduce the risk of premature birth. And her pregnancy was monitored, and her care was delivered throughout the course of the pregnancy. And the result was a healthy, wonderful Arcadius. Now, Purnima benefited from the research that's been done here and elsewhere in the causes of premature birth and in the treatments that can be used to effectively prevent premature birth. And these studies have included work done by molecular biologist, microbiologist, immunologist David Relman, who's an expert on the microbiome here at Stanford. David's found that the vaginal bacterial flora has distinctive characteristics in women who are at risk for premature birth. And that by following and tracking this vaginal bacterial flora, you can more accurately predict if premature birth is about to occur, and then better determine the interventions that will prevent it from occurring. Just one of many examples of how science is transforming the healthcare we deliver and how we're able to predict the occurrences of diseases before they occur or problems before they occur, and then more effectively prevent them. The second example involves Blake, a teenager here pictured with his physician, Dr. Rajiv Kumar, a pediatric endocrinologist on our faculty. Now, Blake has type 1 diabetes, and for years, he and his mother had to track his glucose readings by doing finger sticks, recording them in a book, and sometimes the reading wasn't recorded. It was a pain in the neck to carry around the book. But now his glucoses are continuously monitored with this little patch that you see on his arm. Over 250 readings per day that are taken, transmitted to his smartphone, and also automatically uploaded to his medical record, thereby enabling his endocrinologist and the other team of healthcare professionals to know immediately how he's doing. And now his office visits with his care providers aren't spent rummaging through pieces of paper and books. They're spent instead looking at graphs like the one you see on the device, giving a much more accurate reading on his glucose, management of his glucose, and thereby enabling him to prevent the consequences that are associated with uncontrolled glucose levels in diabetes. And the final story involves Paul. Paul is 30 years old. Paul hasn't known a day in his life when he's been free of pain. Paul has a condition called epidermolysis bullosa. Epidermolysis bullosa causes the skin to slough with even the slightest degree of pressure. His mom has to change the bandages on his arms and legs every couple of days. He's had recurrent skin infections. These infections and the scarring have led to his fingers being fused together. But this story of enormous human suffering now has real hope because Paul is a participant in the first ever stem cell trial for epidermolysis bullosa. A few years ago, Paul received skin-derived cells from stem cells to replace and graft areas of his sloughing skin. Already, this trial is showing enormous promise. It's now entering phase 2. And the promise is that not only will this type of treatment be able to palliate his condition, but offers the hope that someday it will be able to cure the condition. So predict, prevent, and cure precisely. This is the opportunity of precision health. You know, for years, healthcare really has been about sick care. It's been about treating severe acute diseases or their chronic manifestations. And there's been comparatively little attention, either in scientific research or in care delivery, on prediction and prevention. But that's all changing today. And because of the work you're doing in this room, because of the work being done at Stanford, each of the stories you just heard is now a reality, and the future is even brighter and more exciting because of the work we're going to be doing together in the future. The need has never been greater. In the United States today, we spend 18% of our GDP on health care. And yet our outcomes for health care in so many respects are poor and compared to other developed countries. Today in the United States, life expectancy ranks 43rd among developed nations. And recently, for the first time in 2 decades, life expectancy in the United States dropped. We can and we must do something about that. And precision health offers the tools, the approaches, and the opportunities to make a big dent in this, both in the value equation, achieving better outcomes for lower cost, and ultimately creating and enabling a much more healthy population in America moving forward, and indeed in the world moving forward. And there's never been a greater time either in the world at large, with the population continuing to increase and with us still seeing so many infectious diseases, transmissible and non-communicable diseases that are limiting the potential of developing countries around the world. So precision health is within our grasp. What do we need to do to make it a reality? Well, 4 thoughts, 4 enablers that I'd like to leave you with today and that I think you'll see manifestations of during the conference in the next 2 days. First, to make precision health a reality, we need to collaborate across disciplines, institutions, and industries. Second, we need to invest in fundamental discovery-driven research. We need to open up the data, and we need to be high-tech and high-touch. Traditionally, academic medical centers like Stanford have focused on just a small piece of the healthcare pie. Yes, we focused on genetics, we focused on medical care for severe acute and certain chronic diseases. But we know that 75% of health is determined by social, environmental, and behavioral factors. And traditionally, those social, environmental, and behavioral factors haven't been embraced, haven't been studied, or impacted as much by institutions like us as the quarter of the pie that has been devoted towards genetics and traditional medical care. But that's changing. That's changing because of precision health and because of a larger vision of the healthcare pie and the possibilities for improvement of health and wellness through studies and impacts on behavioral, environmental, and social factors. Let me talk about, at a larger scale, 3 initiatives related, 1 each, to each of the elements of precision health: predict and prevent and cure precisely. Sam Gambier, our chair of radiology, is the Stanford lead investigator on the Google Baseline study, just launched a couple of months ago, supported by Verily, or Google, formerly Google Life Sciences, and also being conducted in collaboration with Duke. Baseline will enroll 10,000 people in what will be the most comprehensive longitudinal cohort study ever conducted. Everything you and I can imagine about human health will be measured in each of these people, each of these participants, and Verily created a new wearable just for this project. And through the information that's gathered over the next 4 years and plus in these 10,000 people, we'll have a much better understanding of the determinants of health and wellness. Dr. Tom Robinson, a professor here in Stanford Medicine, is the lead investigator on a study supported by SPHERE, Stanford Precision Health, for ethnic and racial equity. Tom's study involves about 280 obese Latino American children in Santa Clara County. Obesity among Latino American children is the highest incidence among any demographic group in the United States, roughly 39%. And we know that these children with obesity are going to go on to develop a very high incidence of diabetes and other associated disease consequences. Tom's approach encompasses all the different factors that weigh into obesity. Yes, the genetic factors, as well as the microbiome factors, but also the social, environmental, and behavioral factors. And in addition to gathering information about how these factors interact and impact obesity, Tom is looking at interventions, at the effect of doing things such as replacing the plates at home with smaller plates, so less food fits on the plate, and looking at each individual child and their family to decide what type of engagements and interventions are going to make a difference at weight reduction and controlling obesity. And then finally, under the category of cures, the work that Dr. Crystal Makel and her colleagues are doing in CAR T-cell technologies and in approaches towards cancer immunotherapy. We're one of the 6 institutions, we Stanford are one of the 6 institutions participating in the Parker Institute for Cancer Immunotherapy. I think many of us have seen and been remarkably encouraged by the results we're seeing in many different aspects of cancer immunotherapy. Truly some game-changing results. But we still have so much to learn about why some people respond and other people don't, and how technologies such as CAR T-cell technologies can be used in a broader variety of tumors and can be effectively employed in individual cases, in a larger group of individual cases moving forward. So some examples at a programmatic level of how precision health is fueling prediction, prevention, and cures. A key component of enabler of precision health, as I mentioned before, is investing in fundamental research. You know, the transistor was developed in 1947 by a group of engineers who were interested in the fundamental aspects of technology. At that time, they didn't necessarily envision what would happen with the electronics revolution or computers. GPS arose from attempts to test at a higher level Einstein's theory of relativity. And the World Wide Web was first developed in order to enable particle physicists to efficiently transmit their data from one place to another. So many examples of how fundamental discoveries and fundamental research transform entire fields and lives. Michael Levitt, professor here of structural biology and also recipient of the Nobel Prize in Chemistry in 2013, remarked that spending money on basic science pays off. Now, Michael won the Nobel Prize for work he did in the 1980s, really developing the field of computational structural biology. And he did his research because he was interested at using his talents as a mathematician and computer scientist to better model protein structure and transformation. And those algorithms and those techniques are now used very commonly in drug development. Fundamental research will be an extraordinarily important enabler of precision health. And this afternoon, you'll have an opportunity under the tent to see some of the posters work being conducted by our graduate students. We need to open up the data moving forward. And there are tremendous sources of data today, some of those listed on the slide here. And yet that data all too frequently remains cordoned off and partitioned and not available to be analyzed and the maximum benefit conducted and determined. You know, earlier in my career, I discovered a clinical syndrome, superior canal dehiscence syndrome. And yet today, you can get more assistance in making that diagnosis by typing in some key search words into Google than you can from spending an hour on the drop-down and click menus in an electronic medical record system. Now that simply has to change moving forward. And finally, precision health has to be about high tech for sure, but high tech is the enabler for high touch medicine and healthcare. And the examples you saw that I began with today are showing how high tech and how science is enabling our care providers to be more effective in delivering the care that we deliver to our patients, and ultimately and very importantly, in empowering patients, empowering each of us to have greater involvement with our healthcare moving forward. It's now my great privilege and honor to introduce a person who has made transformative contributions as both a scientific leader and a leader in industry. His educational background is in physics, philosophy, and physiology. He's a former Rhodes Scholar. He built his faculty career at the University of California, San Francisco, and at Stanford, where he was a Howard Hughes investigator. He then became the Executive Vice President for Research and Chief Scientific Officer for Genentech, and then the President of the Rockefeller University. And it was Stanford's enormous good fortune in September of last year to attract him to become Stanford University's 11th president. Please join me in welcoming Marc Tessier-Lavigne.
Thanks, Lloyd. Great. Well, thank you so much, Lloyd, for those kind words of introduction. And thank you all for being here. I really have three messages to all of you. The first, of course, is to welcome you to this exciting conference. It's my first conference on big data and biomedicine here at Stanford, but with such an inspiring theme this time around, transforming lives through precision medicine. So welcome to Stanford. I want to thank you. I want to thank each and every one of you for the work that you do day in, day out. You are devoting your lives to advancing the cause of medicine, to alleviating suffering, and to doing so by advancing the cause of precision health and medicine. And my third message to you is that I'm here to exhort you that as hard as you are already working on these problems, to double down again, because of the enormous need that people in our society and around the world face today for more help to deal with the pain and suffering that is theirs. Lloyd started with three very moving examples of families and individuals whose suffering has been alleviated or has the potential to be alleviated by advances in predicting, preventing, and curing disease through fundamental understanding of disease mechanisms and through deployment of appropriate technology and healthcare services and systems. And that's the reality that we must aspire to. It's the vision for our time. We're very fortunate that today advances in science and technology in understanding the molecular and genetic basis of disease, in technology, both from the material sciences, engineering, from bioengineering, Lloyd mentioned stem cell technology, from data sciences, machine learning, artificial intelligence, are all coming together today to put precision health within our grasp. And our role, our charge, our responsibility is to make sure that we get to precision health tomorrow and not 10 years or 20 years from now. We know it will be a reality eventually. Our job is to make sure that we accelerate the development and implementation of precision health. I'm very proud that we at Stanford are hosting this conference. I believe that Stanford is a wonderful fit for a conference on precision health. Stanford, of course, has a wonderful track record of contributing deeply on the science and the technology that is relevant to precision health, and not just from engineering and the hard sciences, but also from the social sciences, as Lloyd emphasized, understanding population health, understanding what motivates people, from the social sciences, economics, from the humanities as well. It's not just the birthplace of key discoveries that are helping advance precision health. It also has a fine track record of taking insights and applying them, developing them often in the private sector through starting wonderful, innovative companies. Lloyd mentioned Verily, which of course is an offshoot of Google, which of course was born just a few yards away in our computer science department here when two graduate students doing fundamental research on databases had the idea for the Google search engine, and the rest, of course, is history. Stanford is a good fit also because although like everyone focused in this field, Stanford is focused on excellence. We are driven to excellence not for its own sake, but to increase our beneficial impact on society. We are a purposeful university. We focus on advancing research and education, but always in service to humanity. And that's what this conference is about. Another way in which I believe there's a consonance here between the mission that you're embracing and Stanford's approach is in the fundamental character of our institution, which is an institution that is optimistic. It's the optimism of the West and the Western spirit that keeps us going. It's a courageous institution that's willing to tackle big and thorny problems. And it's also a tenacious and resilient institution that understands that to tackle big problems, you have to stay at it. And this is what we all face, of course, in tackling precision health. We need that tenacity. We need the courage to tackle a problem. And we also need the optimism, the knowledge that we can make a difference and that we can make a difference tomorrow. I just want to echo two additional themes of Lloyd's before moving on and allowing the conference to move forward. The first is to reiterate the importance of interaction among the disciplines. I was very fortunate, as Lloyd said, to work in the private sector for 8 years at Genentech. I saw one of my colleagues, Michel Rohrer, who's here, the global head of regulatory affairs at Genentech Roche. Welcome, Michel. At Genentech, I saw the power of teamwork. The organization, the company is set up for teams of professionals with diverse backgrounds and experiences to come together and pour all of their intelligence into advancing a major problem. In precision health, we have to bring together all of the disciplines. We have to, and there we face additional problems. Stanford, the disciplines that we need to bring together are well represented here. But in an academic institution, of necessity, we're organized into schools and departments, and that can give rise to divisions and silos between the disciplines. We're fortunate that there's always been a spirit of cooperation and collegiality here. Even more important is that over the past 2 decades, under the previous leaders, John Hennessy and John Etchemendy, a determined effort was made to break down the silos and to stimulate interdisciplinary interchange here on our campus. We made a lot of progress, but we know that there is more to be done. And of course, this isn't just about one institution. It's about interdisciplinary inquiry across many, many institutions represented in this conference room and in the world at large. So we have a big challenge ahead of us to make sure that we bring together the disciplines, that we bring together these different cultures. And speaking of different cultures, the other key point that Lloyd made as well that I do want to amplify is the importance of the interaction between the academic and the private sector. To tackle problems like precision health, we need the insights of scientists working day in, day out in their laboratories, the social sciences, the humanists. We also need the know-how of people in industry and their organization, their ability to take ideas and to translate them into therapies, into cures, into new devices, into new approaches to tackling problems. Again, that requires an openness of mind and a willingness to talk to one another and come together. And I couldn't be prouder that this conference is happening here at Stanford, where we have people from both the private sector and the academic sector. And I exhort you again to create those bonds and strengthen them amongst yourselves so that we can advance the cause of precision health. So it's an exciting 2 days that we have ahead of us. I'm really excited to see what comes of all of the panels, the discussions, the interchanges that occur, and the initiatives that will be spawned from these interactions here today as we break down the barriers, bring the disciplines together, as we bring the sectors together, the academic and the private sector, and as we rally together to tackle one of the great problems but also one of the great opportunities of our time, which is to make precision health a reality. Thank you very much.